So this is going to be stabilization training of the cervical spine. Research has shown that people that have had neck trauma that do not make a full recovery, most of the time it has to do with loss of deep neck flexor strength. And so keeping that from happening is important. Those muscles atrophy in the presence of inflammation, just like quad muscles do. And people wonder why they feel bad 10 years after an accident. Research has demonstrated that most of the time it's because these muscles have atrophied, so we want to make sure that doesn't happen in the first place. Luke, I'm going to have you lay down on this side of the table because I really don't want to deal with any creases or anything like that. I'm going to put this in the small of your neck and talk you through a procedure here. So go ahead and lay down on your back, please. Your neck is going to be over here because I don't want those creases there. There we go. Perfect. Go ahead and bend both knees to flatten your spine, please. And you probably feel that kind of pushing into your neck just a little bit. Now, actually, with Luke, his mid-back curvature is substantial. I would want to do, just a side note, I'd want to be doing a lot of stretching with him in this position, a lot of foam roll used for him because he's a swimmer, and because of that, you can see his neck is in way too much extension. We will work on that later. But for right now, I'm going to try to put something underneath his head so that he's not extending quite that much. This is more for just patient comfort. I'm going to have you look just a little bit. There we go. Back down. Good. So I've already pumped this up, and as what we see here is that the dial is on red. And I would be putting this in at an angle that Luke could see this as well. But I'm going to teach him how to recruit the right muscles. We don't want to be recruiting these front muscles. They're much deeper than that. So if you see him substituting here, we know that we need to redirect him. But Luke, as you're doing this, I want to have your mouth closed, but your teeth should not be clenched together, and have the tongue at the roof of your mouth, okay? And now I want you to tuck your chin slightly. And when you tuck your chin, we should see this needle raise, and our goal is to have it raise. Okay, relax. So Luke did what most people do. He lifted his head, and that's not what we want, right? We want a chin tuck. So Luke, I want your neck pressing into that cushion so that this needle moves up. You see how that needle moves up a little bit? Good. And our goal is to get that to move up 10 points. Luke moved it up about 12 points. The exercise portion of this would be to hold it up for 5 or 10 seconds, hold that for 10 seconds, and of course incorporate this into their home exercise program. But you got that, Luke. You're gonna hold that, hold it, hold it, hold it. And this is a muscle that a lot of us are not in tune to, so it's going to be a little difficult. As we progress this exercise, I'm going to actually let Luke lift his head, and we can actually do a endurance test from this posture. So Luke, I'm going to have you tuck your chin again, press down. Now from there, just lift your head up so that it's at 0. So this thing should be at 0 or pretty close. There we go. And then hold your head up there for as long as you can, and I'm going to time how long you can hold your head up there. And research shows that people that do not have neck pain can hold their head up for 39 seconds. I would not be saying this while the person's doing it because they might hurt themselves, but in a perfect world, we would get a person to the point that they can hold their head up there without substituting with these muscles, and we can do that for a total of 39 seconds. And that's something that's recorded their first visit and something that we'll continue to work on through the process.